Thanks again for joining us, everyone. Today we want to talk a little bit more about understanding Alzheimer's. So I'm here again with Dr. Erin Morland at Vallejo Health and Wellness Center. So to start off, can you just tell us a little bit more about what Alzheimer's is?
Yeah, great question. I think that we talked a little bit about this in the very first video, just as far as what is Alzheimer's. And I think a lot of people may think they have an understanding what it is. They know that it's a person may be losing their memory, but I don't think people really understand what's going on underlying that process. I think they associate it with age, and for sure we do see it as more of a problem as people age. And so we start to look at it as, I think even some people would almost call it, well, this is maybe just a normal part of aging, and it's really not. It's an accelerated degenerative process that happens in the brain, where the brain starts to degenerate, and the places that we see it first are going to be the places that we notice it with symptoms, from people losing their memory to their behavior changes. But actually one of the biggest ones that we see first, although people don't even recognize that they're dealing with this a lot of times, is it actually will affect their sense of smell first.
Interesting.
It is interesting, yeah, because you could do some smell tests on patients to really determine, are they at maybe an early onset, even years before you start to see memory issues. But really when you look at Alzheimer's disease, again, I don't think most people know what it is. They just know that it's a person losing their memory, but they really aren't sure why that is.
Right, and I know that there's more scientific names for these, but you hear people talking about the cause of Alzheimer's being plaques and tangles. Can you talk a little bit more about that?
Yeah, so the terms you're talking about is amyloid plaques and neurofibrillary tangles, and those are definitely associated with Alzheimer's disease, meaning that you do an autopsy on someone that had Alzheimer's. If you're not sure they had Alzheimer's, they'll most likely find amyloid plaques or those neurofibrillary tangles.
Okay.
And to understand what those truly are, we're going to get into a little bit of science here, but not too much. We have these proteins that make up our cells. They make up our membranes of our cells. They make up the structure of our cells. So neurons are no different. And so we have these proteins on these neurons that get cleaved off, and then your body gets rid of them. Okay, and if they get cleaved off in the wrong places, or if your body just doesn't get rid of those cleaved off proteins, then what can happen is that's when people will start to develop an amyloid plaque. Okay. And then the neurofibrillary tangles, we have these proteins in our body called tau proteins. And what they do is they make up the structure. If you've ever seen a neuron, they've got these arms that stick out of them, these nerve cells. These arms stick out, the axons and the dendrites, if you remember back in science class. But they, what they do is they give those tau proteins give it structure, they give it stability. But as a cell starts to age and it needs to be broken down, or it needs to make new proteins, those tau proteins can become misfolded, and then that affects the ability for that neuron to do what it's supposed to do. And we do see those neurons in what we call the hippocampus being affected first, or else other parts, like I mentioned, parts of the brain that impact the sense of smell, but in the temporal lobe, which is on the side of our head, is where those neurons lie, and they seem to be affected first. And so those proteins, get misfolded, they form a neurofibrillary tangle, the neuron stops working, and the ability to create memories gets impacted. And so the thought was that these tangles and these plaques are what's causing Alzheimer's disease. But what they've done through many, many years of research is try to develop medications then that would get rid of those things. And if they could get rid of them, they figured, hey, then we've just cured Alzheimer's disease. Which would make sense, right? So if that is the cause, you get rid of it, then you've just solved the problem. Yeah, you should be. But according to all the research that we're seeing and the medications that have come out that have done that, you've actually seen very little improvement in those patients. And in some patients, you actually saw them get worse, which made no sense. So now the theory is that maybe those tangles and those amyloid plaques are actually a protective mechanism.
Okay. Okay, yeah, that makes a lot of sense that, they're there, they're not causing them, they're more protective. And so that would account too for if someone takes that medication that is supposed to get rid of those and you see them get worse.
Yeah, which again, if that was the cause, getting rid of something that causes something, you should get better, right?
Right.
And so the protective mechanism is there must be some kind of an onslaught happening to the brain, that the brain's saying, hey, I need to protect myself, and I'll do this by forming almost like these walls. And so I remember years ago going to that play, Les Miserables, and I remember there's a part in the play where they are being attacked, and so they go into their houses and they bring out chairs and dressers and tables, and they build a wall on the street to protect themselves. And so it's good that they can protect themselves, but you think about it, now they can't use the chair in their house, they can't use their dresser, their table. So all that stuff is good for a wall, but now the things that it was designed for can't be used. So it's like that with the brain. So you take these proteins that were really designed to make those neurons work the way they're supposed to, but you build a wall with them instead, protects from the onslaught of that damage. But it unfortunately, what sacrifices the cells can't work anymore.
Right.
And the way the body works, it's very intelligent, is that it's going to protect itself with the most sacrificial type of things that you can use. So meaning like you want to use cells that you could live without. Now, can you live without your memories? Unfortunately, you can. It's nice to have the memory.
Yeah.
But you can live without your memories versus cells that control whether you can breathe or not. So, so the way Alzheimer's works is it starts sacrificing cells that you can get rid of. So starting with memories to behavior to your personality. But then it will eventually work its way back into the brain and start impacting parts of the brain that are critical for survival, like breathing and vision and such. So that can go as well. But that's really what those plaques and fibrillary tangles are there for.
Okay. And so now we know that the plaques and the tangles are not a cause of Alzheimer's. The other thing that people say or frequently believe is that Alzheimer's is completely genetic.
Sure.
So can we cover that?
Yeah, absolutely. And I think that when we look at genes, we gotta look at there's different types of genes that happen that are in our bodies. So we have genes that are turned on all the time, and they're the genes that really tell what our eye color is, our skin color. So we have those genes, and then we have genes that get turned on and off depending on what the body needs at the time. So we call those epigenetics. So you can literally eat a food that will turn on a gene. You can get exposed to a toxin that can turn on a gene or turn off a gene or speed up a gene. So these are the genes that we're talking about. So there really isn't ever been a gene that's discovered that they said, oh, that person has this gene, they're going to get Alzheimer's disease. But there is a gene called the APOE gene where you are more susceptible. And so, and really specifically it's the APOE4, because we all have an APOE gene. Some of us have it's a 2, some of us it's an APOE3 or an APOE4. And when we have, from our mom and our dad, both get an APOE4, if we get both of those, then we are more susceptible. In fact, some studies would say 80 to 85% more susceptible to developing Alzheimer's. Doesn't mean you're going to get it, but it does mean that you're going to have to work a lot harder than somebody else. So the genes don't specifically cause the disease. And really, if you look at why APOE4 is there in the first place, is that people that have that APOE4 gene, they actually do really well in situations where they come across something that would cause inflammation in their body. Like let's say I'm walking in Africa, I don't have shoes on, I step on things, I get exposed to bacteria. That APOE4 is going to increase my likelihood of survival versus an APOE2. Okay? But the person that has an APOE4 gene that can protect against that inflammation, if they have constant inflammation, then it's going to create all kinds of issues like what we see with the plaques and the tangles. And the problem there is then you're going to start to see some major brain development, degenerative processes happen in the brain. So it's a good gene in certain situations, but if you're constantly exposed to inflammation and longevity, as we live longer, we see that gene can actually work against us. So yeah, so again, to answer your question, no, the genes don't cause Alzheimer's disease, but there's certain genes that can set us up for it. And just to mention a few other ones is we have genes that make neurotransmitters in our brain. And one neurotransmitter that we use for memory is acetylcholine. And so if a person has a genetic issue where they don't make as much acetylcholine, and now they're getting an onslaught of toxins and inflammation, and it impacts that gene, you're really going to notice it in that person. Or a person that can't utilize fat very well. And we know that the brain is made up of 60% fat, so now you have a gene that's not working really well, it doesn't allow you to make fat, and now you can't repair those cells as quickly as somebody else, do that onslaught. And so again, not just that APOE gene that we need to think about, we need to think about some of those other genetics as well.
Okay, so definitely some genetic factors or epigenetic factors, but that isn't necessarily the cause.
Absolutely.
So then can you tell us what is the cause?
Yeah, and I think that people have been trying to discover what's that cause, what's that magic bullet that we can figure out what's causing this, because then we can make a medication that would get rid of it. And I think that's one of the big reasons we see that there isn't a medication that's fixed Alzheimer's yet, because there really isn't one cause. Dr. Bredesen in his protocol has found and discovered that there's about 6 different types of Alzheimer's. And because there's 6 different types, there's lots of different causes to each type. When he first developed the protocol, he found about 36 different reasons why someone would develop Alzheimer's disease. Now, as the studies keep going on, the research keeps going on, they're finding over 100 different reasons why someone would develop Alzheimer's disease. So when you look at it like that, there's no drug that's going to address 100 different 100 different things. And so each one, let's just look at the type of inflammation. So if we look at inflammation causing Alzheimer's, well, that could be anywhere from someone's diet, it could be an infection that they got exposed to, it could be like a gene like the APOE4 that's getting turned on. And so inflammation could have many different causes. Toxins, we know that toxins can have many different causes. We think of mercury being one. We think of, when I was a kid, I remember them saying that aluminum was the cause of Alzheimer's. You got to get rid of your aluminum pots and pans. Anything like food that comes in an aluminum can could potentially cause Alzheimer's disease. So then they started lining those cans with plastic. Well, now we're seeing things like BPA and those kind of things. Those toxins can also cause damage, degenerative changes to nerve cells. So we look at it and we see that there's a lot of different causes to each one specifically. So that being said, there really isn't one cause to Alzheimer's disease, but the great thing, and we're going to talk about this more when we get into the different types of Alzheimer's, we are going to address what are those causes to each one of those. But the great thing is, what we've found is that when you apply those things, they also help with other diseases too.
Interesting.
Yeah, like you think about heart disease, and you look at Alzheimer's can be related to blood sugar issues. Well, so can heart disease. Diabetes is obviously related to blood sugar issues. And so if you address that thing with the brain, you can also be helping heart health. You can also be helping just systemic health through blood sugar control. So the nice thing is, as we address these things, the viewers are going to find that, wow, I apply these things now, I'm at less risk for cancer, I'm at less risk for these other chronic health issues.
So if people want to know more about the different types of Alzheimer's, like you said, that is one of the videos coming up in the series, so stay tuned for those, keep watching. But overall, I think that's all we had for today, unless there's anything that you wanted to
I guess the
cover.
only thing I would say is, again, just if you haven't seen, maybe this is the first video you're watching. I think the big thing to understand is that there is hope. Again, when you look at Alzheimer's disease, I think a lot of people have been told, well, once you get it, there's nothing you can do about it, you can't reverse it. If you have family members that have it, it's probably inevitable that I'm going to get it. The longer I live, the more likely I'll have Alzheimer's, and that's just not true. There's a lot of things that can be done for it. And so if you haven't watched that first video, I would highly recommend you as the viewer to watch it. If you haven't subscribed to the whole series that we're going to be sending out, there's going to be a link here that people can sign up for those videos. And I would just say, highly encourage people to share these videos with their friends and family members, because again, if they're at risk as far as a family member having it, they'd want to share it with the rest of their family to know that there's things that they can do. And as the rates of Alzheimer's is going up significantly, I think a lot of people, this is something that weighs heavily over them. Like when I'm out talking to people, I'll ask people how many want to live to be 100. I would say very few people ever raise their hands, because they see, well, what does it look like to live to be 100? And I think that you can live to be 100 and thrive at 100 years old still.
Absolutely. Well, thank you again for sharing all of this information with us today. Everyone, stay tuned for those next videos. Have a good day.